never understand murmurs and maneuvers, so how about I go through it and break it down really easily. So what is a murmur? A murmur is turbulent blood flow across the heart valves. Now, if you think about it, if you increase the amount of venous return or preload, amount of blood coming back to the heart, that's going to increase the amount of blood volume going across these damaged valves. It's going to increase the intensity of the murmur. Now there's two exceptions to this, but we'll leave that to the end. So let's go through them. If you squat, that increases systemic vascular resistance, increases venous return and preload, and increases the intensity of the murmur. Similarly, a leg raise uses gravity to increase the amount of blood back to the heart. It increases the murmur. Now for something like a Valsalva, where you blow against a closed system, it's going to increase your intrathoracic pressure, compressing these veins, so there's less blood going back to the heart, less venous return preload, which is going to decrease the intensity of the murmur. Now finally, the hand grip maneuver is going to increase the resistance that the heart has to pump against, so that increases your afterload. If you increase your afterload, that's more blood in the heart, that's more turbulent blood flow, increasing the intensity of the murmur. Two exceptions: hypertrophic obstructive cardiomyopathy. That's an obstruction. The heart is hypertrophy. The septum is blocking that outflow tract. So if you actually have more blood in the heart, that's going to relieve the obstruction. And finally, for mitral valve prolapse, well, the leaflets are prolapsed. They're not working well. So if you actually increase the amount of blood, they're going to put the leaflets back into place, decreasing the intensity of the murmur. So just know these exceptions and this one rule, and if you got murmurs and maneuvers down.